Healthcare is a particularly challenging topic. It's a big problem. I suggest we approach it with three ideas. First is to divide it into separate categories, link it to service, and change our tax structure to remove the employers as the middleman. First, let's clarify our terminology and divide a big problem into smaller problems that might have different solutions. So I suggest we create 6 categories to facilitate choice of appropriate solutions. First, there's prevention. We need to consider the kinds of things that need to be done to prevent people from getting sick or developing long-term problems. We need to be able to take care of emergency situations and acute care like broken bones, car accidents, toothaches. Then there's the chronic conditions, the ones that are long-lasting and require continuous long-term care. There are major expensive surgeries that don't happen to everybody, but if they do happen to you, it could ruin you economically. Then there's the end-of-life issues, how to deal with the elderly and their medical care. And finally, elective procedures, like eye lifts and things like that. So I think if we separate the issues like this, then we can look at what role government and private insurance and different kinds of creative solutions might apply to each one. In this idea of cut out the middleman, we need to make the consumer the customer of healthcare providers. And again, this is an idea, this is a problem that was created by a good idea from our tax program, where we gave tax exemptions to employer-provided healthcare programs. This was one of those good ideas that had unfortunate unintended consequences. So I propose we remove the cost of healthcare from a company's products, first of all, and let's take a look at what that means. Just in the last 10 years, from 2005 to 2015, the average annual health cost went up from $10,800 to $17,500, a 61% total increase. The consumer saw an increase, and but the employer saw an even greater increase. All of this kind of money, the $17,000 per worker, is applied to the company's costs. So I suggest we let the companies focus on their core business instead of being a parental figure and providing benefits and health care, and take the tax break off the table, another tax break that needs to come off the table. And if we make the consumer the customer, that means people would have some idea of what things cost, and people could make choices. So we would have this. We could start to have a reason to do something about the great disparity in drug costs between the United States and other countries, and just being able to find out what a procedure costs when you go in to get it, whether the MRI locally or the one across town might be thousands of dollars different. I think we need to link, we need to make sure that certain categories of health care are provided for everyone. So I think everybody should get basic health care. So I think categories 1 and 2 of prevention and acute care should be something that everybody can have. I would propose that we have health care plans that one could subscribe to. And we know that preventing the spread of disease and damage to unborn infants is actually a cost-cutting factor. It saves the economy money if we do that. So as a consequence, everyone should have it, whether regardless of how much they could pay. But I suggest we make a monthly basic care fee, not a per visit fee, because people need to feel like they can use the service for their children as needed. If you recall, when in the early days of the internet, we were charged by the minute for connection, and people weren't really using the internet. They felt constrained. although it made sense economically, it didn't work. And so when companies like AOL decided to charge for a flat monthly fee and you could use the internet as much as you wanted, then the use of the internet took off. So I think the same thing might apply to buying a plan to take care of categories 1 and 2. Now, since I think everybody should have it, the government should support this. I think everybody should pay something, but because you still need to be the customer, you have to have some skin in the game. But the government would provide matching funds based on income so that everybody could afford it. Then the providers, like cell phone service providers, could compete for the business. So people could choose who they went to, or which group they subscribed to, and how much they paid for that acute and preventative maintenance care plan. It would help keep the costs down. I suggest we link healthcare benefits to public service. So in those other categories that are costly, we could, instead of just giving people universal health care of all kinds, we put the government in the position of rewarding service with health care benefits. So let's take a look. We have programs in the military, and I suggested 2 other programs in the Diplomatic and Disaster Relief Corps, where people who spend 20 years of their life dedicated to that service would retire with full medical benefits and a retirement income. And I would link it to whatever the U.S. Congress votes itself for benefits for their relatively short term of service. If you are in one of these services and you serve less than 20 years, you get a proportional benefit. In other words, if you serve 10, you'd get half pay for retirement and for medical benefits. Domestic service corps of only 2 years still would qualify people for major supplements for health care in categories 3 through 5. The amount would depend on how much money we have, but it would be a step toward making it more affordable for everybody, making it possible. But it also is a great reward for giving 2 years of your life to the country, and the two would go together. There are many more ideas that need to be thought of regarding healthcare, but for other ideas on other topics, you can go to my playlist on YouTube, or you can go to pctraining.net/vision.htm, and we'll talk more.